I get extremely frustrated when I see patients that are referred to lymphedema services and they've been leaking for weeks, months, sometimes even years. And district nurses or community nurses may have been going back and forth to treat them, and no sort of effective management has been used for them.
So, British Journal of Nursing Chronic Oedema Nurse of the Year Karen Morgan has created an evidence-based practical guide to treating leaking legs that's been fully road tested with patients like Robert.
Hiya.
Hello, how are you?
Good. You okay?
Yeah, good to see you. Do you want to come with me?
Yeah, certainly.
Lovely.
What's the problem?
Traditionally, nurses have been taught that we don't apply any compression to any patients on their legs unless we perform an ankle brachial pressure index or a toe brachial pressure index. So that, for me, delays treatment for patients with chronic oedema. Okie doke, going to take your shoes off.
Okay.
Recent evidence suggests that actually you can apply inelastic bandages safely without performing a Doppler or an ABPI or a TBPI. But still that isn't transferring into change of practice. They look amazing.
A lot better than they were. A lot better.
They do look amazing.
I was walking around as if I had wellies on before.
Robert's legs are now in really good shape. But it took him a long time for him and his sister to discover that there was treatment for his sore, swollen and leaking legs.
They were actually leaking quite a lot of fluid, and that was obviously making your trousers wet and your bed wet and very uncomfortable.
And it raises the risk of skin infections like cellulitis. The whole experience is distressing for patients and their families.
At one point, it took 3 of us to get him off a chair.
So to do nothing is not really acceptable.
Instead, we want to make sure that you know about an evidence-based, safe, simple solution: bandaging.
So I know your legs have been washed and creamed,
Okay.
so I'm just going to bandage your leg as a level 1 support, as I would have done in the past when your legs were leaking.
Put a highly absorbent dressing over leaking wounds.
This is support only, there is no compression at all in level 1. So padding is the most important. Sometimes patients are reluctant, you might have been reluctant, Robert, to have a lot of padding on your foot,
Yeah.
because you can't get your shoes on. And then of course we make it more difficult for people to mobilise safely then. But there are bandaging shoes that you can use. We use those for you,
Yes,
so
you
you
did,
use
yeah.
them short term. What that does is support your feet, allow you to mobilise.
Yeah.
You know, the more you move, the more the calf muscle pumps, the more we move the fluid away.
Yeah.
We encourage at least 3 rolls of wool.
You're trying to create a smooth, cylindrical shape.
So this is just the final layer of level 1, and it's just the top layer of liner. So as I said, no compression, just support, which provides the patient with a comfortable, supportive, padded bandage. And that's your level 1. No compression, just support. How does that feel?
Great, just to go with a sock on.
Good.
Simples. Now for those toes. If you are going to compress the leg, you have to manage toes as well.
So when you apply the toe bandages, you anchor on the foot, not too tight. So we come around, we're not pulling firm, we're just laying the bandage down. That's how tight it should be, not tight at all. So then we come on to the big toe, come back through, and make sure we cover all of the skin of the toe up to the base of the toenail. This can be used as a prevention of toe swelling and also a treatment of toe swelling. Then we come back onto the foot and back on to the next toe. The little toe never really swells at all, and you don't really want to bandage the little toe because you don't want any pressure at the end of the toe here.
I had to bite my lip, you realise that? Didn't
You were very good.
Very
you were very
sensitive
good.
feet.
Very good.
Measure the base of the foot and choose the right size from the compression garment formulary, published by Lymphedema Network Wales.
So this is the toe cap. The little toe doesn't need any compression. So straight away, I cut the little toe off, on the garment, of course.
Mark the base of each toenail and trim the garment to fit.
So that's your toe cap.
Thank you.
Good. Okay, so we'll leave the toe cap on there and I'll go on to do level 2 support. So we'll leave this leg as level 1 and now I'll demonstrate level 2.
Level 2 bandaging is what you did for level 1 plus a compression bandage on top.
This leg now has 4 rolls of wool on and you can still see that actually at the top it's quite thin. So if the patient was leaking, we'd ensure that they had another roll of wool on there. And you can see that that is protecting that leg, giving you a nice cylindrical shape.
We've written this all down for you, especially the bits that we know cause concern.
If there is no history of arterial disease or any arterial symptoms, as per your holistic assessment of that patient, it is considered safe to apply 14 to 17 milligrams of pressure. We apply a short stretch bandage which is inelastic, 10 centimetres in width, in a spiral application from the base of the toes to the knee in a 50% overlap and stretch up to the knee. So toes to nose for me, lovely. And then we're applying the bandage in a spiral. So we anchor the bandage. And then I get you to lift your foot for me. And we're applying it not quite at full stretch because you want to become more confident with your management with the patient and increase the compression as they are able to tolerate it and you have more confidence in applying it.
Leave a gap below the knee so it doesn't catch.
How does that feel, Robert?
Great.
Good.
Bit of support as well.
Can you
for it.
feel the difference between
Yeah.
level 1 and level 2?
Level 2 is tighter than level 1. It's easier to walk with these on than with them off because you don't get, obviously the soreness on the water and everything's all splashed about and stinging. But it seems to keep it more stable. You feel it's easier to walk with it, like, you know. So I prefer the compression personally myself. I prefer 2 rather than 1.
If you've done a holistic assessment of that patient, there is no risk of causing harm for that patient. You start at level 1. If you feel confident, move to level 2, remembering that you have to refer to a lymphedema service as well, and then you can move to level 3 confidently with their support and advice. So toes to nose for me, Robert, lovely. His foot needs to be up so that he's got good movement when he's walking in those bandages. So it's applied in the opposite direction from what you've just applied. So we applied the bandage in a spiral all the way up. We're now applying in a spiral in the opposite direction.
Top it off with a liner so the bandage doesn't catch on other materials. And notice the difference in size. This leg has no compression. This one with 2 layers is much slimmer.
I feel really passionate that patients need to be treated promptly like this because it's not good enough for patients to have a pad and a liner. That's why we developed the wet leg pathway, so please use it for benefit of patients.
When you go back to thinking how you were, the pain you were in, and trying to fix the problem where you didn't have the backing behind you, and once you got the backing with you, the matter's fixed within a couple of weeks. So yeah, it's a fantastic thing, and for the patient it is fabulous.
For your guide to 3-step bandaging, contact the Lymphedema Network Wales. And don't forget to refer your patient to the lymphedema service early to get garments made for when their legs are healed. They keep the legs in good condition, like Robert's.
Can I have new stockings with those seams on the back?
Yes, you can.
Oh, good.
If you want stockings with seams, you can have them.
Because it shows the centre of my leg then, see? Thank you, Karen, for making me better.
Thank you for letting me use your legs to demonstrate
Thanks, Karen.
that.
Well done, Karen. Hooray!